Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to talk with you about maintaining good health for men who are taking hormonal treatment for the management of prostate cancer. In this video, I will discuss some of the common side effects that occur with hormonal treatment and discuss what should be done in terms of maintaining good health during this treatment period. Some of the side effects that occur with androgen deprivation therapy or hormonal therapy for prostate cancer include osteoporosis, hot flashes, weight gain, and sexual problems. Osteoporosis is defined as a decrease in bone mass and as a result can result in increase in bone fractures. Although osteoporosis is more common in women, men also suffer from osteoporosis, and 12 million American men are at risk for osteoporosis. Also, men who undergo androgen deprivation therapy or hormonal therapy are at even a greater risk of having osteoporosis. The longer a man is receiving treatment with androgen deprivation therapy, the greater the risk is for osteoporosis. In order to diagnose osteoporosis, a bone densitometer scan or DEXA scan is usually ordered, and this measures the bone mineral density. We suggest that you maintain a healthy weight, participate in weight-bearing exercises, including walking and resistance training. I also recommend not smoking and also minimal amounts of alcohol. In men who do have osteoporosis or at risk of osteoporosis, I recommend supplements including calcium and vitamin D. Calcium is necessary for bone strength and bone mineral density. You need a diet rich in calcium, which includes non-fat or low-fat milk, dairy products, broccoli, and even tofu. If you do not get enough calcium in the diet, then I recommend supplements such as calcium citrate or calcium carbonate, and it's best absorbed at 500 milligrams per day. Vitamin D is also necessary to promote normal blood levels of calcium to maintain strong bones. 1/3 of Americans are vitamin D deficient. Vitamin D leads to brittle bones and increasing in bone fractures. Vitamin D is found in wild salmon and in fortified milk. And vitamin D is also produced in the skin after exposure to the sun. I recommend that anyone who is receiving androgen deprivation therapy receive between 3,000 and 4,000 units of vitamin D per day. Magnesium is also necessary for good bone health. A deficiency of magnesium leads to brittle bones and fractures. Magnesium is found in leafy green vegetables, whole grains, and nuts. Vitamin K is important for bone health and also for blood clotting. Vitamin K is found in leafy green vegetables. I caution men who are on blood thinners, particularly Coumadin, can be affected by consuming vitamin D and vitamin K and need to have their INR levels regularly checked. However, it is safe to take 100 micrograms of vitamin K and not change the Coumadin dosage. Hot flashes are usually mild in men who are receiving androgen deprivation therapy, and I recommend that men speak to their doctor as solutions can be found if the hot flashes persist. Weight gain is also a common side effect of androgen deprivation therapy, and it increases the risk of heart disease and increases the risk of diabetes. If a man gains a few pounds, they need to take action to reduce the weight gain and may need to see a nutritionist or increase their exercise level. Finally, sexual function may be impacted in men who are receiving androgen deprivation therapy. It can result in a decrease in libido and erectile dysfunction or impotence. I suggest men who are experiencing this side effect talk to their doctor to find options for dealing with these symptoms. In summary, patients with low bone mineral density or osteoporosis can take supplements such as vitamin D and calcium, and there are also prescription medications available to men to protect against osteoporosis. Lifestyle changes and supplements are also helpful, and it's also useful to take adequate calcium and vitamin D. I hope you have found this video helpful and useful. If you have any additional questions, please do not hesitate to contact me via my website, www.neilbaum.com. Thank you.